Hi, have you ever tried doing this? Collect a sample of your cells from your mouth by rinsing with salt water and just adding a little detergent. What it does is dissolves your cell and nuclear membranes, and then in a few minutes you will see these fibers rising out of the milk, and these are your DNA, and this is what decided that you're human, whether you're brown or black-eyed, or you have long or short hair, whether you're a male or female. But think of these cables not as a leash that constrains you, but as your life's endowment. It's almost as if the curtain of the drama of your life begins with this. And what better way than raising this curtain of your life before life begins itself? And this is what pre-implantation genetic diagnosis is all about. Now, who should be subjected to pre-implantation genetic diagnosis? It is really recommended for people who have a known genetic disorder in themselves or in their siblings, or there's a family history. Also, we advise it for women who are older, say about 35 years of age, who've had recurrent miscarriages, who have had problems of infertility before and have had a number of failed unsuccessful IVF attempts, men who have had fertility issues. Who else do we advise to have pre-implantation genetic diagnosis? Now, women who've had repeated miscarriages, women who are above 35 years of age because the eggs are getting older and may have genetic mutations that will lead to children being born with some sort of genetic abnormalities, men who have had fertility problems, who have had couples who have had many unsuccessful IVF attempts. Now, all these people, finally we have a technique which can help them. So how do we go about doing it? We superovulate the women, collect the eggs, fertilize them with the husband's sperm, and once the embryo starts multiplying on day 3 or 5, very skillfully one cell is collected from this embryo without any damage to the rest of the embryo, because remember, that is your potential child. Now, what do we do in the lab with this cell is we subject it to genetic diagnosis by fairly advanced techniques like FISH, PCR and comparative genomic hybridization. Now, high sounding words, but basically these are genetic techniques that look at your chromosomes, which are 23 pairs in every human cell, and count the number so that we will only select the embryos which have the right number of chromosomes. Also, by the advanced techniques like microarray and CGD, we look at every single bit of the chromosome to make sure that there are no deletions, inversions. Basically, in simple terms, anything that's missing or extra or not be present where it should be or missing a part of it. Now, once we have satisfied ourselves that out of the embryos that have been biopsied, we choose the best ones, and on day 5, we then return the best embryos. Now, it sounds really simple, isn't it, when I put it like this? But what it really involves is a big team that is working behind scenes to make sure that we put back the best embryos possible. Now, remember, this is a very skillful technique. There is a chance that we can damage the embryos. It's a very rare chance, but it has happened. The other thing that's important is that we also are putting back embryos. Now, there's no way one can guarantee a pregnancy. Then we leave it to forces that help you to get pregnant. Now, once you're pregnant, of course, you're sure that the embryo that has been put back is free from any genetic errors. Now, this remains a controversial technique because remember, when we are looking at the chromosomes, we are also checking whether it is a male or a female embryo. And there are people out there who would choose to just selectively put back the desired sex embryo. Now, of course, it's a couple's decision, which is then backed by a lot of cultural and religious factors. So we as doctors and scientists don't want to be a part of, wrong decisions that are taken by a couple. However, this technique has revolutionized what we call personalized medicine, because really, even before the person is born, we are making sure that the child is not carrying any genetic disorders. And of course, we are also removing the problems of women who have had recurrent miscarriages or who have chosen to start their families later on in life, and giving them a chance to have a normal, healthy baby.